you go.
I'm going to assume then that Bob's Peak is the one with the gondola on it.
That's a good assumption.
I never really thought of what that peak's name was. Who's Bob? How do you get a peak named after him?
Your
There are
uncle?
so many unanswered questions.
Bob's your uncle. All right. We've got a couple of minutes left. Let's get to the gnome shortage, because the gnome shortage is a hoot.
Yeah, so obviously it's very interesting. While other countries potentially lamenting the lack of, or the speed at getting a COVID vaccine, the UK are up in arms about the fact that there's a gnome shortage. I mean, this is terrible news.
They said it's a perfect storm of a lockdown and everyone staying at home doing their gardening, plus a shortage of raw materials to make gnomes. I've never really thought about the gnome construction industry, but also how many people need to buy a gnome that there is suddenly a gnome shortage. Like, who is locked down and think, you know what this place needs? A gnome.
Well, I guess, there's no gnome place like gnome, and a gnome is where the heart is.
Oh, my goodness me.
This is the greatest day of puns ever.
Thank you. I've got about one more.
Oh,
Go on,
we'll
I want to hear
squeeze
it.
in because we've got about 30 seconds.
There was that thing about the fake tan. She made a big mess in her hotel sheets, and I just think, for me, putting it on TikTok, she was just trying to get attention.
Oh,
there you go.
Terada, you're gonna have to work on your puns, man. You're just left in Karen's wake.
I'm waving as her pun boat sails away. I couldn't even make a pun then.
I'll buy you a gnome.
Thanks.
That's a promise. Right, thank you both very much. Talking to Karen O'Leary and Terada. This is 9 to noon. Thank you so much for your company. Catherine Ryan will be back with you on Tuesday. Have a safe long weekend.
Ko te reo irirangi o Aotearoa, nau mai ki te pūrongo o te pautūtanga, Kombiri Anna Johnson, aho. This is Midday Report for Friday, April the 23rd. Rua te kau mā toru o Painga Whawha. E haere ake nei. Chris Hipkins is set to make an announcement on our borders.
We want to let people know what we're doing around India. It was a 2-week pause.
Our councils will be scrutinised in a wide-ranging review.
Today is an important day for the entire local government sector and for communities and councils alike.
In business news, Ate Pūrongo Pakihi, a review into the rise in telco complaints. And later in sport, Ki roto te aoha kina kina, Super Rugby's Trans-Tasman draw is finalised. But first, here's the news.
RNZ News at midday. Kia ora, ko Nicola Wright there, nei. The government will soon announce a further bolstering of the border, with passengers on high-risk flights to be kept in separate hotels. The Covid-19 response Minister Chris Hipkins is set to update media shortly on plans regarding the India travel suspension and managed isolation. Here's our Deputy Political Editor, Craig McCulloch.
Despite a second wave of COVID-19 ripping through India, the government looks unlikely to extend its travel ban beyond its expiry next week. Instead, it will implement a suite of tougher MIQ measures, which have long been called for by epidemiologists and opposition parties. For example, RNZ understands people arriving on high-risk flights, such as on the United Arab Emirates route, will be kept together in managed isolation. The change will reduce the constant overlap.
Kia ora koutou. Hello everybody, and thank you for joining me today. From the beginning of our response to COVID-19 and over much of the last year, our border has been our first line of defence against the virus. Through our managed isolation facilities, we have helped around 135,000 people return to New Zealand or arrive in New Zealand, and we have done so very safely. Across that time, we've picked up just over 800 cases of COVID-19 through our managed isolation facilities, and we've seen only a handful of transmission events as a result of that effort. So it has been very successful, one of the most successful border defences in the world, and I want to pay tribute to the team who work at our border, our managed isolation facility workers, and all of those who are keeping New Zealand safe. We've always been open about the fact that we are constantly looking to review and improve our systems. Where weaknesses are identified, we look to close down the risk of virus transmission, to reduce the number of cases coming into New Zealand in the first place, and to continue to strengthen our defence. The more we learn, the more that our response can be tailored to particular situations as they arise. This constant learning and improvement has served us very well. It's made possible by the efforts of all of our team of 5 million. And as a result, New Zealanders are enjoying now and continue to enjoy freedoms that many other countries around the world are only just starting to rediscover again. We continue to be optimistic about the future. As more people around the world get vaccines, things will continue to change and freedom will continue to increase. But that does not mean that we won't have to continue to make decisions as situations arise in the meantime. So today I'm updating you on 2 significant decisions that we have made to improve our overall defences at the border. The first is the creation of a new category of very high risk country. It's expected to significantly reduce the number of infected people flying into New Zealand. We've done this in the face of rapidly increasing rates of infection in some parts of the globe. Our actions based on what's happening in those very high-risk countries, the prevalence of Covid-19 variants of concern, the public health measures that other countries have in place, and the overall risks to New Zealand through our border. Any case at the border creates additional pressures on our managed isolation and quarantine facilities, and it adds to the risk of transmission to other people, first and foremost as guests, but also border workers and potentially the wider New Zealand community. A travel restriction can help us to manage that risk, and it already has been. Earlier in April, the very high number of cases being identified amongst travellers from India necessitated an urgent restriction on travel from India, and we put that in place. Since then, we've reviewed that approach and the approach to managing the risk of importing COVID-19 from India and from other very high-risk countries. So we've considered the cumulative risk to New Zealand by assessing the likelihood of individual travellers having COVID-19 given where they have travelled from when they arrive here in New Zealand. For now, this assessment is based on the proportion of travellers from each country who have COVID-19 when they arrive in New Zealand. Given the difficulties that we have in corroborating case rate data, daily case statistics from other countries, the travellers arriving in New Zealand data is the best data that we have available to make these decisions. But we will continue to develop the very high risk country framework and we'll provide a further update on that in coming weeks on the process for adding new countries to the list and on the process for removing countries from the very high risk country list. Countries that have initially been designated as very high risk are those where more than 50 cases of COVID-19 per 1,000 arrivals have been detected here in New Zealand. We have, of course, recognised that some countries have a very small number of people arriving in New Zealand, and therefore those statistics are not necessarily a true reflection of risk. So we've put a floor in place where the threshold will only apply to countries where they have, on average, more than 15 arrivals into New Zealand in a per month over a 3-month period. That way we can target where we are most at risk of seeing high numbers of positive cases coming in. Initially, India, Brazil, Papua New Guinea and Pakistan are the countries that meet this threshold, and so they will be classified as countries that are very high risk. Despite the high reported case numbers in the US and the UK, where testing rates are also very high, travellers from these locations are about 10 times less likely to have COVID-19 when they arrive at the New Zealand border than someone coming from India, and 6 times less likely than someone coming from PNG, Pakistan or Brazil. The new category will come into force at 11:59 p.m. on the 28th of April. As a result, travellers from those countries will be temporarily restricted to New Zealand citizens, their partners and children, and parents of children who are New Zealand citizens. This is expected to reduce the number of potential cases coming here from India alone by 3/4, or around 75%. All travellers will require evidence of a negative PCR test from an accredited laboratory before travel. All other travellers, including New Zealand residents and permanent residents, will be required to have been outside of a very high-risk country for at least 14 days before flying into New Zealand. I want to stress that this was not an easy decision to make, and we do recognise that this will have a significant impact on a number of people. This decision's been based entirely on a risk assessment, and it will be regularly reviewed. There will be an exceptions process on humanitarian grounds. From tomorrow, we're also introducing a change to the way we handle arrivals in New Zealand in our managed isolation and quarantine facilities. This change has been made possible through the introduction and the opening up of the Trans-Tasman travel bubble, which has provided us with an opportunity to do things differently. As I've said, releasing rooms freed up by the bubble on a one-for-one basis for additional travellers from higher risk countries is not an option. It would increase the overall risk in our MIQ facilities significantly. While freed up rooms have and will continue to be made available, we've been careful to ensure that we're not increasing risk levels. Today, I can confirm that most of our managed isolation facilities will be moving to an enhanced cohorting or group intake system to further reduce the risk of in-facility transmission. As has been canvassed before, we have been cohorting arrivals as much as possible up to this point by keeping people from the same plane together as much as possible. But we have seen instances where different planes have been arriving in the same, plane loads of people have been arriving in the same facility over a period of time. So under the new plan, returnees arriving in New Zealand over a 96-hour window will be delivered to MIQ facilities until they're full or the 96-hour period is over. The facilities will then lock down for a 14-day cycle, with no additional returnees allowed until after the last cohort has completed their stay and the facilities have been cleaned. We'll then start the process of filling that facility up again. This will ensure returnees will be in the same facility as others who have arrived at about the same time, and importantly, it will keep those who have just arrived apart from those who are coming towards the end of their stay in managed isolation. The Pullman Hotel will be the first isolation facility to receive cohorted arrivals starting from tomorrow, and the transition to the new approach will be completed by Sunday the 16th of May. Day 0-1 testing, people staying in their room until the negative results are returned. Day 3 and Day 12 testing, limited exposures to others when exercising or smoking, and physical distancing will continue to apply across all of our facilities. I want to end by emphasising what I said at the start. It's important that wherever travel restrictions are applied by New Zealand in response to a risk assessment, that they are for a well-defined period, that they are reviewed regularly to ensure that the measure remains proportionate to the level of assessed risk. The first assessment will take place within the next 2 weeks. We don't assume that the situation will not change, it will. Indeed, we hope that the COVID-19 situation from any very high-risk country improves quickly, first and foremost for the people of those countries. As I said, the government does not make these decisions lightly. We realise they impact on people's freedoms and they create real challenges and inconvenience, but they are the right thing for us to do at this time. Limiting arrivals from very high-risk countries at this time will substantially reduce the flow of COVID-19 cases into our managed isolation system. When combined with the enhanced cohorting measures that we're putting in place with a system that's already served us very well, we'll be able to manage the risk even more effectively to keep New Zealanders safe. Happy to open up for questions. Lisa.
The 96-hour window, can you just clarify that? So will that be only people from the same country of departure, or will you mix and match?
No, it'll reflect the planes that they've come in on. So basically the idea is that you start with an empty facility. Over 92 hours you have plane loads of people all being transported to the same facility, either at the end of the 96 hours or once the facility is full. That gets effectively locked down for a 2-week period. We have to recognise that the country of origin isn't necessarily the best and only marker of risk for this particular purpose, because people are often interacting in transit and on the plane on the way to New Zealand.
But to be clear, you could have people arriving from India going into the same hotel as people arriving from the UK, even though those countries have different classifications.
We would certainly be trying to make sure that very high risk and high risk, as as much as practical, are being kept separate, but bearing in mind that those coming from very high-risk countries will be arriving on the same plane as people coming from high-risk countries. So to some extent, that's beyond our control.
Not always, though. So there is an element of mixing and matching in your cohort in terms of the risk classification of the country.
Well, if you look at where the majority of our very high-risk country passengers are coming at the moment, they're coming through the United Arab Emirates on a particular flight. That flight also has people from Europe and from all around the rest of the world as well.
So in terms of people who are not New Zealand citizens, who have rights to reside here in New Zealand, is it your expectation that they will have to exit a high-risk country, pay for 2 weeks accommodation somewhere else, and then you will allow them into New Zealand?
That's right. So we haven't said, we have to provide a pathway for New Zealanders to come back. We've always been very clear, other than where there's a very short-term reason to put a restriction in place, we would not restrict the right of New Zealanders to return home. A permanent resident, of course, has somewhere else that is their where they are a citizen. But if they do wish to come back to New Zealand, then they can do that, but they have to spend 2 weeks somewhere else first.
How many people are in that category as far as you know?
As I indicated before, in terms of the overall arrivals from India, which is the largest group affected by this at the moment, around 75% of the overall number coming in would be affected, of our positive cases would be affected by this. So it would be a reasonably significant number of people. We've been receiving...
Sorry, Minister, just to clarify that, are you saying 75% of the people who would have been coming in on planes from India
No, sorry.
can now no longer come?
Sorry, that's positive cases that we're reducing there. In terms of the numbers, I think we've been receiving from India around 450 a month, roughly, coming in from India. So it's possible that a reasonable proportion of those were permanent residents and so on. So we are talking about hundreds of people that could be affected by this.
Limiting the number of people coming in from these high-risk countries show that you don't have confidence in our current border systems to manage those risks?
No, it's just the fact that the higher the concentration of positive cases that you get within them, the more likely you are to experience issues. So we want to provide a very robust system, as robust as we can make it, but recognising that there is no such thing as zero risk here. The fewer cases coming in, though, the lower the risk will be.
So epidemiologists have been calling for some form of cohorting for months now. Why has it taken this amount of time to get to this stage?
We have been doing cohorting already, in the sense that we've been trying to keep plane loads of people together.
But not separating people into hotels for certain periods. This is very much a new thing you've just introduced.
One of the
this long to do this?
One of the big reasons for that is it has a very significant impact on the overall efficiency of the MIQ system. We will be able to have fewer people in the MIQ system. More rooms will remain empty because of the use of this particular cohorting method, and that could be somewhere between 10 to 15%. So that is quite a significant number, fewer people that we'll be able to provide accommodation for.
What do you say to those people who may feel that these rules persecute them or target them or treat them unfairly? What do you say to those people?
So this is done purely based on a risk assessment, and so I've tried to be as transparent as I can about the formula that applies here. It would apply to any country that meets that formula. That's how, based on our current calculations. So we haven't discriminated. We've applied a formula, and that formula is where we get the number of countries that are being added.
But it's pretty tough for those travellers.
I don't underestimate how difficult travel restrictions have been for New Zealanders around the world over the last year, and this adds another group of people who will be whose travel will potentially be disrupted.
You've previously said some of our MIQs are not up to very high risk arrivals. So which ones are suitable for your cohorting?
Look, the vast majority of them are. What we are looking.
Okay, so tell me the ones that aren't then, that's the shorter list.
Look, there's negotiations going on with those particular facilities, and so I don't want to flag those.
It's a matter of public interest. If you're a returnee,
there are no.
It's luck of the draw whether you get a good hotel that is fitted out with the best equipment, the best ventilation system. Some hotels have high risk, so tell us the ones that you don't think are up to very high risk returnees.
Yeah, I'm not going to do that today. Ultimately, there are some who would cope with a higher concentration of higher risk returnees better than others. And there's a variety of factors, including how much physical space they have in them, the ventilation systems that are within them, the transport arrangements to and from them, the arrangements around exercise areas and so on. But I'm not going to release all of that today while we're in negotiations with those hotels.
When will you release it?
Look, once we've confirmed what that's going to look like, once we've got contracts, once we've determined whether any of those facilities are going to be repurposed or released from the system, then we'd certainly.
What is the time frame to do that?
Look, it's happening at the moment.
If we look at the daily case numbers in India at the moment, they've pretty much tripled since this flight ban was first implemented. Are you confident that these changes you're announcing today are going to be enough to ensure that COVID doesn't get into the New Zealand community?
Look, we do have a very robust managed isolation and quarantine system, and it gets stronger and better all of the time. Ultimately, this is about reducing the risk within that system. If you look at the number of cases that have made it out of the border, it's very, very small relative to what we're seeing around the rest of the world. So we've managed to contain COVID-19 very well, whilst case numbers have escalated significantly. The challenge here is that we don't want our system, our MIQ system, to have so many positive cases within it that we actually increase the risk, too much.
These countries that you've identified as very high risk have been arguably very high risk for quite a while now, especially India and Brazil, for example. Why are we only moving to label them like that now?
What we've seen just in the last few months, and I was looking at this even as I've been monitoring it right the way through. Just in the last few months, we've seen a real spike in the number of positive cases coming in from those countries that we weren't seeing before. So if you look at
the arrivals from India were spiking for a long time before you moved to
No, we were still seeing overall in our managed isolation facilities, we were averaging out at positive case numbers around that 3 to 4 a day. We were seeing that spiking up to around 20 plus on some days, and that's only happened in the last few months.
So you stand by the time frame that your government has followed?
Yes.
The opposition have been calling for, in addition to risk-based MIQ systems like you've now announced, they've been calling for things like antigen testing, daily saliva testing for border workers. Are these things possibly in the pipeline as well?
We've already been clear we're actually out in the market at the moment around saliva testing. So we will be looking to put saliva testing on a more frequent basis in place. In some cases to spread out for those who are being really tested frequently the number of nasal pharyngeal swabs that they have to take, recognising that that's quite an invasive procedure compared to a saliva test. So we will have more on that once we're through that process.
What about those rapid antigen tests for people before they board flights?
Rapid antigen tests in some cases are being used for pre-departure testing, recognising that it helps to filter out the risk, but it is not as reliable as a PCR test. So we will require PCR tests for those coming from very high-risk countries, because that is still at this point the most reliable way of removing or minimising risk.
But has the number of arrivals from those countries sort of proven that possibly a more direct test right before you board a flight necessary as an increased buffer?
One of the things that we've looked at over the last 2 weeks is whether we could have different testing methods in place for a country like India, point of departure testing and so on, and whether that's logistically feasible. And the advice that we've had so far is that it wouldn't be. So, but we're reviewing this on a weekly basis because ultimately, we only want restrictions to be in place for as long as they absolutely need to be. So, we're testing technology can provide a practical and implementable solution. That's one of the things that we'll keep in the mix.
For the hotels where unfortunately will be happening, will exercising, so people going on bus rides to go and work out or go for a walk, will that still be in place? Because there's one thing, experts are saying we should crack down on is get rid of shed spaces, get rid of the smoking areas. Is that going to happen?
So one of the things that we will look at, obviously, is in our consideration of which facilities we may keep or change, exercise, the ability to exercise, whether we have to bus people to be able to do exercise. That system has been improving as well. So including making sure that people who are getting on the bus are in the same bubble. This will be a lot easier now because the same bubble will largely be kept in the same place, and they'll be on the similar kind of timetable. Making sure that there's distancing on the buses, making sure that they're wearing PPE when they're on the buses, and maintaining their distancing.
But coming back to Lisa's point, I mean, effectively you may cohort these people into our hotel, but you're still mixing people from different countries with risk profiles different. So there is still the risk of COVID transfer between those people if they jump on a bus and go.
And that risk generally has existed from before when they've arrived in New Zealand. There are very few flights that are bringing, there are no flights in fact bringing people only from one country. Most of those flights are coming out of a hub where people are melding together from a variety of different points of departure.
Then why not restrict them according to the flight that they arrive on?
As much as possible, we'll be aiming to get the same flights into the same facilities. If we were to say have 50 people arrive on one flight, and then we were to shut that facility down and have only people from that flight in that facility, our capacity reduction would be significantly more than the 15% that we're going to get from doing it this way.
Isn't that the point, though, Minister? Have you made this decision based on not what is the best methodology to do it, but because of your concern that you will not have enough beds?
No, this is about looking at how we best manage the risk. We do have a balance here.
No,
we do want.
Best managing the risk, Minister, would not that be confining?
Well, best managing the risk would have no one coming in at all, and that's not what we're going to do.
But you say you've got a legal responsibility for returnees, right? So bearing that legal responsibility in mind, wouldn't the lowest risk option be to cohort people according to the flights that they came in on?
Well, that's exactly what we're doing, so that they will.
But not entirely. You're mixing.
There could be several flights in one facility, that's correct. One of the challenges that we have at the moment is, in an ideal world we would have the same number of people, the same number of flights, same number of people arriving each day, every day, over a period of time, and you could manage, cohorts much more easily. The reality is that the number of arrivals from red zone countries can vary hugely from a couple of dozen in a day to a couple of hundred in a day, and so we have to have a system that allows for that.
MIQ staff, will you restrict them to working at a single facility if you're cohorting returnees? Are you going to cohort workers as well?
That's largely happening now, in the sense that the only people that would be moving between facilities would be the health staff. So those are the people who are doing the testing and so on. Not necessarily that would mean that we would need to significantly increase the number of people involved there. Ultimately, though, those staff, those health staff, can go home at the end of the day and they can go to a public event. They have PPE, they are keeping themselves safe.
If the UAE flight is one of the highest risk flights, as you have identified, why not put a cap on the number of flights you will accept on that particular route?
It's not so much about the number of flights, it's about the number of people, and bearing in mind that the high concentration of those people, a high concentration of the risk on that particular flight has been people who have been coming from India. If we were to simply reduce the number of flights from the UAE, then those people could potentially be transiting through a different country instead, and it wouldn't necessarily reduce the overall risk. We're already limiting the options significantly through the travel restriction that I've just announced.
So in terms of percentages of positive tests, right, one scientist is saying about 10 to 15% positives on the last couple of months arriving on that route, right, UAE, versus 1 to 2% across the board. Can you tell me what the figure is? What can you tolerate? What can you cope with safely in terms of the percentage of positive arrivals?
Oh, as few as possible, ultimately.
Of course, but where is the point where you switch over into, whoa, we can't.
There isn't a magic number here, but ultimately, when we're dealing with sort of that 3 to 4 to 5 cases in a day versus, getting up around 20 in a day, there's a big difference.
So what percentage around about can you cope with safely?
I wouldn't put a number on it.
So if you've got the 96 hours, is there a risk that we may not be able to have as many people coming into the country and have to stop people coming in because our hotels are full and reach capacity in those 96 hours? We actually have to say to people, look, sorry guys, you can't come.
It will restrict the number of vouchers that we're able to release through the booking system. So yes, there'll be a 10 to 15% overall reduction in the number of rooms we are able to make available. Bearing in mind that because people are booked for a specific date, we can use that to map out and plan the cohorting.
So sorry, how many rooms is that?
Well, we've got about 4,000 rooms overall.
How many people with existing MIQ vouchers might be affected by this? Is anyone going to have to rebook or change things around that because of this?
No, at the moment our MIQ bookings are not at capacity. So we've seen a downturn in demand, particularly since the Trans-Tasman bubble opened up. And of course we've re-released, or when I say re-released, we've cancelled the bookings of people who were coming from Australia to New Zealand who had a room booked. And that again has freed up quite a bit of additional capacity too.
You're standing down the Grand Mercure and the Grand Millennium, right? So you're showing up shop there for a period of time. Well, how does that play into this plan? How long can you afford to have those two offline?
One of the things that we're doing at the moment is there was a lot of maintenance work that was planned for later on in the year. And so we're trying to bring that forward now to a period where we know demand is lower than it has been because we've got capacity there at the moment. What I didn't want to see is that those rooms sat empty and then later on in the year when they're trying to do maintenance there was an increase in demand. So they're bringing forward some maintenance. That means that for things like the Grand Millennium and the Grand Mercure coming offline for a little bit, it's not going to disrupt the overall capacity. Don't know at this point. Depends how long the work takes.
Is it concerning that a border worker for Swissport has told me they hadn't been tested for 6 months and the Ministry of Health has confirmed 7 workers in total for the same company are overdue tests, and yet Swissport seems to have different information. Does that concern you?
I saw the story this morning on the way here, and my understanding is that Swissport have stated that that particular worker only worked on international flights on a few occasions and most of their work was domestic, and therefore that will affect the number of times they needed to be tested. So the Border Worker Testing Register will record all those who are being tested because they at some point have worked at the border, and it will tell when their last test was, and it will flag up if they haven't had a test for a period of time, but it won't say whether they needed to have one. So if you take someone, for example, who's a security guard at an MIQ facility, if their primary job is to secure a warehouse somewhere and someone else is away sick and they're brought into MIQ to do a couple of shifts, they would then need to be tested as a result of that. They may then go back to securing their warehouse and they wouldn't need to be tested, but the system would flag them up as having not been tested.
Understood, but what's clear is that your testing register as it currently is not very reliable, is that right?
No, the testing register for those who are on it is very reliable. It will say exactly when the person was last tested.
Well, that would seem to contradict what the information coming from the Health Ministry and Swissport. I mean, the Health Ministry says according to their research of the register, there are 7 workers who are overdue. They don't know how long they're overdue because all the data is incomplete.
No,
so it doesn't sound like it's very accurate.
No, what it will say is that there are 7 workers working for Swiss who have not been tested within the last 2 weeks, but it won't tell them whether they needed to be. Only the employer will know that information because, like I said, in the case of someone here, they may have been working all domestic during that time and therefore they wouldn't have needed to be tested, or, that's in the case of the ground handlers.
How can a register be accurate and up to date if you don't know the actual number of border workers we have in New Zealand at the moment?
So the register is designed to record who has been tested and when they have been tested. Ultimately, the monitoring of who needs to be tested and the responsibility for that has to sit with their employers. The only alternative would be for the government to be managing staff rosters for every firm that works at the border, which would be completely impractical.
But it's just the oversight of this seems to be the ministry's got some information, the employers have got different information. I'm just wondering when you guys all have information that actually backs up and it's accurate.
I don't think they do have different information. So like I said, the register records when the person was last tested. The employer determines when someone needs to have been tested. In this particular case, from what I think your story said, the employer has said that the person only worked internationally on 1 or 2 occasions. So that would determine...
And that's disputed by the employee.
Yeah.
They have evidence of that they worked other shifts in February, which they didn't get tested afterwards, and the company did not have records of this. So, I mean, isn't that an issue?
Well, that's certainly a concern for that employer, yes. But like I said, that's not necessarily something that the government is able to police for every employee working at the border. So we do rely on employers making sure that they are keeping good records of when their staff worked and where they worked.
What about fines? I mean, you mentioned, the Prime Minister fines. So how many fines have you dished out?
Ultimately, I don't dish out the fines, so the fines can be issued by a medical officer of health or by the New Zealand Police. My understanding is very few, if any, have been issued. Have any been issued? But the other legal, I don't, not that I'm aware of. I think there may have been one, but I haven't seen the details of that. The other avenue, of course, that I'm aware of is that WorkSafe have an ability to prosecute, and not just not just through what we're doing here, but actually they have a wider remit that allows them to look at whether employers are protecting the health and safety of their workers.
Do you know what percentage of employers are complying with the orders at the moment?
Again, it's based on the information that we have. We've seen good levels of compliance, but I don't have a record of the working hours and duties of every one of the 20-odd thousand people that work in some capacity at the border to be able to test to be able to run that against the testing register.
Minister, the MIQs, how many of them have had the upgrades that you promised after the Pullman outbreak?
So they've all had what's called a desktop review of their ventilation systems. Some have had upgrades already. So most of the lifts, for example, have had the HEPA filters put on them. Well, one of the issues here is that you have to take a facility offline in order to do the upgrades, which is what's happening at the Grand Millennium and the Grand Mercure at the moment. No, the Pullman has been upgraded. Some of them didn't need as much upgrade work.
Outside of the Pullman, how many have had the upgrades?
It depends on what the upgrade work was. So, so lifts, for example, my understanding is that all the lifts across the different facilities where they needed an extra filtration system in them has been done. Where there's
how many with completed upgrades? Let's make it easy. How many with completed?
I haven't got that number.
So only the Pullman, maybe?
No, I haven't got that number. I just couldn't give you an accurate number.
Minister, why is the government contracting with DHBs for saliva testing, using a supposedly less effective test than the one that Rayco Science is using at Auckland Airport?
Look, ultimately that's a decision that I don't take. The decisions on which tests to use, we leave that in the hands of the medical professionals.
Minister, considering the recent transmission in MIQ hotels, are you satisfied with the reports which haven't found the conclusive cause of transmission?
No, it's well, yes and no. I mean, I think that they're doing what they can to find the cause of transmission, but the reality is, it's sometimes we will never know, and they'll leave no stone unturned. But sometimes it is a virus. At the end of the day, it doesn't always leave a nice little trail for you to be able to identify how it's spread from one person to the next.
Minister, just one question. Is it frustrating that people are still travelling from such high-risk countries so far into the pandemic, and that you do have to let them in because they are citizens?
I think where people are travelling out of New Zealand to a very high-risk country, or even a high-risk country, there are often very compelling reasons for that. It's often a compassionate reason. They'll have a terminally ill family member and so on. So with this new restriction that we've put in place for very high-risk countries, we do still have a grounds for humanitarian compassionate exemption, if you like. And so we'll release more information on that about how people apply for that if they're in that category.
Minister, Kiwi scientists have developed a coating that kills 99.9% of virus particles on surfaces, including PPE. That's at Victoria Uni. Given we've seen border workers still getting infected and transmission happening in facilities on surfaces, would you consider using a tool such as this?
Look, I think where there's any new products coming to the market and where people can demonstrate their efficacy, yep, there are avenues for them to look at bringing them into the market. And of course, you know, we're out in the market buying things, and something that the people who are doing the procurement will look at.
So one of the
last couple of questions, yeah.
One of the key things here with this testing and responsibility of employers is that these two former workers from Swissport are saying that there was no obligation, no follow-ups, no checks by the employer to get the tests. I mean, isn't that the fundamental problem? And is that a concern? If there's no actual follow-up, where's the initiative to go and get the test?
If there is a problem with a particular employer, so when a case like this comes to light, then obviously that's something that the teams, the government teams working at the border are able to investigate, and so I'm sure they will be as a result of these most recent allegations around Swissport in particular. As I've indicated before, WorkSafe also have the ability to investigate, and they actually have quite significant legal powers, including the ability to prosecute firms where they're not doing what they need to be doing.
Swissport has just last night emailed and texted workers to say that we are now going to text and email you when you're due to get a test and you must get a test. I mean, shouldn't that just be in place for employers from the get-go?
It already is. So if someone is on the testing register, they will get a text message when they are due to be tested. That's based on the testing cycle that they were signed up for when they joined the register. Now, bearing in mind that can change. But if, for example, they were a worker that needed to be tested weekly, at the end of that week, they'll get a reminder, text messaged directly to them, the employee, saying you need to be tested. It'll come before they need to be tested as a reminder. Their employer will also receive a message alert about that same employee saying that person needs to be tested. Now, obviously, there is a big if there, in the sense that if that person's still been working during that time in a role that requires them to be tested on an ongoing basis. And there are a lot of people, would be a significant number of people who will join the register for a one-off event. So there might be a tradesperson going into an MIQ facility, for example, who does one job and then they leave. They need to be tested, they'd be on the register, but they may never go back. So
understood. So your officials are investigating this scenario in Swissport at the moment?
Oh, absolutely.
Now, just finally on this, I mean, the register, we know, because the Health Ministry's told me, that only about 3 weeks ago you had data analysts actually looking at the data, and yet you're saying that it's a really good register and it's reliable. How can that be when you've only recently got people in there to actually look at the information?
So one of the things that they've been looking at is whether there are any duplicate records in there that might be complicating the system. So if there are people, for example, who have different variants of their name, sometimes they can have more than one entry in the register.
So those
are the sorts of things that are being checked to make sure that that's been an ongoing process. To give you a bit of history, when NHI, National Health Numbers, were first introduced, a number of people ended up, this was years ago, with multiple NHI numbers. Now, Health have worked over several years to really iron that out, but it's possible that there are still people out there who've got more than one NHI number.
Minister, what advice have you had about your legal obligations to those permanent residents that you won't allow a direct route into New Zealand to?
Sorry, what was that?
So what legal advice have you had about your legal obligations to permanent residents who are sort of being rerouted through other countries if they want to come back here?
So ultimately we must, under international conventions, allow citizens to return to New Zealand, so we don't create people who are stateless. As I've indicated before, if someone is a resident or even a permanent resident, then they have another country of citizenship.
Is there a light at the end of the tunnel for those people that are needing to come back?
Look, I think there's a light at the end of the tunnel for all of us. We just don't know how long the tunnel is at this point.
Given India's recorded the highest ever daily total of COVID-19 cases, 315,000, presumably these permanent residents will be stuck there for quite some time unless they can get to another country.
Look, I think we all look at the situation in India, and I feel for people in India. There's no question about that, and I absolutely acknowledge that for those who have a relationship with New Zealand, who are currently in India and who would like to come back to New Zealand, that this is a difficult decision for them. It's definitely not one that the government has taken lightly, and it is one that we will be keeping under constant review.
Can we assume that most of those cases that had been coming in were people who fell into the permanent residents or residents category as opposed to citizens?
In terms of the breakdown of positive cases coming in, yes, there was, like I said, you get about a 75% reduction in that by removing both of the other categories. So the other categories were permanent residents, those coming in on essential work visas where there was a border exemption that applied to them. My understanding of the numbers, I just don't have them in the absolute front of my mind, although I've seen them in the last sort of 72 hours or so, is that the majority of that category were in the permanent resident or resident category.
What consideration have you given to the fact that you may be putting their lives at risk?
Look, we absolutely acknowledge that for those who are in a country where COVID-19 is spreading rapidly, there are a lot of people who would far rather be somewhere else in the world at the moment. And I acknowledge that this is a difficult decision for them.
Does the government have a problem with needle supply, given that we've got free vaccination starting next month? And if there is a problem, what are we doing to alleviate it?
No, all of our supplies are good. The key supply that we're short of is the vaccines themselves. And so when they start to arrive in larger quantities, we'll see that things scaling up from July. I can tell you that the scaling up is proceeding in line with the plans we released last week. So 9,200 doses of vaccine administered yesterday. That tips us over just over 200,000 overall. The overall stocks, we've got about 450,000 in stock at the moment. What you'll see though is that over the course of the next 9 weeks or so, the stockpile will go down as the number of doses administered goes up, so that the point that when we start seeing big numbers of doses arriving, we're not seeing a dip down before we go to scale right up again.
Okay, so do you foresee any kind of delay with the fact that the ministry admitted that they only 6 weeks ago started to make a booking system for the public? Do you see like a delay if that booking system isn't as always as fragmented as it seems to be at the border?
No, not at all. I think the big risk is people making bookings and then not showing up for their vaccines. That's the thing that could really slow us down when we get into doing big numbers of vaccines a day.
So how long will it take you to cancel somebody's appointment, or how will you deal with that problem?
That is something that we've been working our way through. The team doing that have been working our way through modelling all of that. What we will have though is people going around and moving vaccines around on any given day, so that if a vaccine centre had 2,000 people booked, and they're telling us in the morning we're having a higher no-show rate, we'll be able to go and take vaccines off them and give them to another place that has a higher than expected rate.
The system does rely on people basically sitting refreshing the computer looking for a slot, does it?
The booking system will have a plentiful supply, but yes, there will be a daily limit based on the capacity to deliver. Yeah.
Minister, question for us.
Very last question. Yeah.
What's your expectation around sports teams that are set to be coming into the country in July, particularly from the Italian rugby team, for example? Are there plans in place already to manage that, and how we might do that differently?
Yes, there are. We're obviously, when we're talking about sports people, we're talking about quite limited numbers of people, but there are pretty robust arrangements in place for them, which includes how we manage them, how we manage any training that they need to do, and how we manage all of that very carefully. If there's any risk, then of course things like training, if there was to be any risk, then we would scale that back. So
Minister, you get weekly updates on tests.
This is Malaya. We'll give you one more each. There you go.
Yes, you get weekly updates on testing. You said a couple of weeks ago. So how many people have missed tests this week?
It's the numbers that I get tell me how many people have been tested. So if you look at the MIQ workforce, for example, I can tell you that on a fortnightly basis, we're doing around 5,500 to 6,000 tests on a fortnightly basis of an MIQ workforce, and that's about 4,500 people in the regular MIQ workforce there. But I don't get a spreadsheet of every single person, no.
Would you like to get a spreadsheet of everyone to know if they've been tested?
No, I think that's cheeky, but no. Yeah, Lisa.
So the county's Manukau DHB catchment,
Yes.
can you give us an end date for when you're going to get through vaccinating the people in that catchment?
Look, they'll be similar to others. It'll be by the end of the year. That's the goal. But obviously, counties Manukau are ahead of everybody else at the moment, and there's been a real emphasis on making sure that they can stay ahead of the pack based on the level of risk.
But you don't have an end date. You haven't seen a forecast for when they'll be complete.
I just don't have it with me. I have got the DHB by DHB breakdown. It's on the website. Everyone can see it. It shows how many vaccines each DHB will be doing week by week.
One more, I swear, one last one.
All right.
Thank you. Was any consideration given to New Zealand managed pre-departure quarantine in India?
Look, yes, a little, but it just wouldn't have been practical. Thanks, everybody.
Thank you very much.